Now is the time to take the patient into the magnet room itself. Once safely in the MR environment, it is good practice to take a moment and let the patient see the system. Briefly describe parts, and if possible allow the patient to look around the back of the magnet or look down the bore to reassure them the scanner is not closed in. Point out the patient entertainment system, if present, and allow them a moment to take it in. Your responsibilities at this point are to ensure the patient is comfortable and can remain in the scanning position for the duration of the scan session, which could be up to an hour for certain studies. To ensure the coils and other equipment are placed optimally for the scan. For example, is the correct knee in the coil? Is the abdominal coil placed centrally over the liver? And to ensure the patient can be safely scanned and the risk of radiofrequency, RF burns, has been minimized. As the patient is being positioned on the magnet table, take this opportunity to reiterate the examination process and what is required of them, as patients may forget information that has been given to them earlier due to the unfamiliar surroundings and stress of the examination. This is also a good opportunity to explain to keep their hands away from the pinch hazard at the edges of the table, as the table will move in and may also move during the scanning procedure. Different patient setups may be required due to imaging many different anatomies and functions. The ideal arrangement will also vary by scanner manufacturer due to the different designs of RF coils available and magnet types. For example, you may have a choice of a tilting head coil or a head coil arrangement which can be used without a top component.
Before you position the patient, you just need to do a final safety check, and you're checking their ID as well. And during that, you're checking that the area of the body you're thinking you're scanning is the area of the body that they think you're scanning. And at that point, you can explain to them about how they're going to lie on the table. If you're using a fixed coil, then positioning is fairly obvious, and you just put them in the centre of the table and cover the coil over the anatomical area. If you're doing something where you're using a flex coil, for example an elbow, then you'll need to position the patient as far across the bore as you possibly can to try and get the elbow into the bore centre, because that's where you get better image quality. You need to make sure that there's no pinch points, obviously, so that you can move the patient in and out freely. You need to centre the coil onto the body part anatomically, and then you need to make sure that the coil is centred into the centre of the bore to make sure that you get the best image quality you can possibly have. You need to obviously make sure that the patient's comfortable and that they know they're going to have to lie still for quite a long time. And before you leave, you should never put them into the scanner unless you're there to watch to make sure that they're okay before you leave. And obviously then just communicate with them to let them know that they're in the right place and that you're going to start the scan then.